Environmental restraint in residential aged care in Victoria. Can aged care residents freely move around their environment? In Australia, an aged care resident generally has the right to move around their aged care facility freely, except where there may be a risk of harm to the resident or others. Practices that restrict a resident's access to all parts of their environment for the main purpose of influencing their behaviour are known as environmental restraints. Examples include restricting a resident's access to common areas within the facility, like the living areas, or restricting access to items and activities that the resident usually has access to, like a mobile phone or attending an outing. Environmental restraint is a type of restrictive practice because its use restricts a person's rights or freedom of movement, and it can only be used as a last resort to prevent harm. How to recognise when an environmental restraint is appropriate or inappropriate. Sandra has mild dementia and often forgets where she has put her mobile phone, so has asked staff to keep it in the facility's office until she would like to call her family. Sandra tends to speak very loudly when on the phone, so staff have a specific area for Sandra where she does not disturb anyone. One evening, Sandra asks for her phone to call her daughter, but the staff member says she's too loud and will not give Sandra her phone. Sandra does not understand why she cannot use her phone in the designated area. This is an inappropriate use of environmental restraint, as keeping Sandra's mobile phone is not for the primary purpose to influence behaviour in order to prevent harm. If Sandra's behaviour was harmful, such as throwing her phone at other residents, then taking her phone to stop or prevent harm may be an appropriate use of environmental restraint if all obligations are followed. Some of the obligations that an aged care provider must follow when applying environmental restraint include: 1. Alternative strategies should be considered and attempted to help change the behaviour of the resident. Such strategies must be documented. They may include talking with the resident, using relaxation techniques, or changing the environment to make them feel more comfortable. 2. A health practitioner with a day-to-day knowledge of the resident must assess if the environmental restraint is necessary to prevent harm. 3. Obtain consent to the environmental restraint from the resident or the resident's restrictive practices substitute decision maker if it is determined that the resident cannot make their own decisions. 4. Monitor the resident while the environmental restraint is in place to assess whether the restraint should be reduced or stopped. In emergency situations, trying alternative strategies and obtaining consent is not required at the time of the emergency. For more information on environmental restraint or to arrange a free legal consultation on an issue related to aged care, please visit agedcarejustice.org.au or email info@agedcarejustice.org.au.